Now, you guys already know this. I will always get emails or Facebook messages or angry people telling me I'm too hard on Republicans and whatnot. Well, this is a perfect example of why I am. Brit Hume, take it away.
But we're also learning, and not surprisingly, that some insurers are finding a way around the requirement that they must accept all customers regardless of their physical condition, whether they have a pre-existing condition. For instance, some people with serious diseases, they're saying, well, the pill that you must take to stay alive or to alleviate your condition, that won't be covered. So they found a loophole.
That's what insurance companies do. They try to make their risk pools as narrowly drawn as possible so that they can avoid having to pay out the benefits. That's what they do. And the law was written in such a way that apparently there are opportunities for them to do that. It's how insurance works. Too much risk in your pool, you don't make money, you don't do business, you go down.
Okay. Understand what he just said. This is very, very important. Chris Wallace sets it up and says, look, there are some companies that, with the whole pre-existing conditions mandate, they're looking for loopholes to try to get out of covering people with pre-existing conditions. They'll just say to them, your policy doesn't cover whatever the thing is for the pre-existing condition that they have. So let's say somebody had cancer in the past or has cancer right now and they're looking for insurance. They go, oh, sorry, we don't cover chemotherapy. And then the person, of course, will be outraged and they'll need that chemotherapy, so they try to find a way to get covered. But did you notice what Brit Hume said? He goes, oh, that's just what they do. It's what insurance companies do. So, Brit, you're telling me you're okay with death panels. That's what that is. No. It's no ifs, ands, or buts about it. It's no like, hey, what's your opinion on it? What's his opinion on it? No. It's cut and dry. It's black and white. He just explained to you it's just what they do. It's fine. I got no problem. That's just how they function. That's what insurance companies are. No. This is the actual death panels in our healthcare system. It's the private insurance companies. Because they have a fiduciary responsibility to their shareholders to make a profit and to continue to do so. It sets up a perverse incentive. And what that incentive structure is, okay, try to weasel your way out of paying out on all the claims, because if you paid out on all the claims, you might not make any money. So pay out as few claims as possible for people who are actually sick and need the help, okay, and then put all the money towards profits for your shareholders. This is why, by the way, private health insurance never works. This is why we have 45,000 people who die in the U.S. every year, because they don't have access to basic health care. This is why we have 48 million uninsured people. Meanwhile, how many uninsured do they have in Canada or France or Britain? 0, 0, 0. How many people die in those countries because they don't have health care? 0, 0, 0. So our private system is a disaster because by its nature it will be a disaster because there's a poor incentive structure. But what I'm amazed by is the hypocrisy. Because these are the same people who screamed and yelled and bitched and moaned day in and day out about fictional death panels in Obamacare. Oh my God, they're going to pull the plug on grandma. They're going to tell you what things you can and cannot have, what care you can and cannot get. This is an outrage. We can't have that in health insurance in America. Unless it's a private company that has the death panels and tells you what you can and cannot have. Then Brit Hume is fine with it. Then, oh, it's just how the system works. Where's the outrage, Brit? Where's the outrage? If you actually cared about people and you actually cared that somebody might not be getting the care that they need, then it wouldn't matter if they're being rejected by the government or by the private sector. You would rage either way, and you should rage either way. But no. Since you're an idiot, you only rage when it's the government who restricts care, which, by the way, they're not doing. You made it up that they're restricting care, okay? But when it's the private sector that says, no, we're not going to pay out because you have a pre-existing condition and you might die now, you say, yeah, whatever, no big deal. It's just how they function. It's just how they work. See, these guys they're pathetic. They're pathetic, helplessly partisan idiots. I mean, and I know people, oh, you're too harsh or this or that. No, it's not me. It's not me. I didn't make Brit Hume say that. Did I make Brit Hume say that? Is he my fucking sock puppet? Is that how this works? No, he said it on his own. He's an adult, okay? And he's an adult who is a massive hypocrite and a pathetic hypocrite. Where's the outrage? I'll sit here, I'll wait for it, man. What do you think happens when somebody gets rejected for pre-existing conditions? They have two options. Number one, pay out of pocket and go bankrupt. Okay, this is why medical bills are the #1 cause of bankruptcy in the U.S. What's the second option? Just don't get care. What's going to happen if you don't get care and you have a serious pre-existing condition? You die. So there are the actual death panels. Those boards in the private insurance companies that sit down and determine who to fuck over and who not to pay out on and who to kick off the rolls and who to not give coverage to because they have pre-existing conditions. There's your real death panels. And what does Brit Hume have to say about the actual ones, not the fake ones he made up? Crickets.